Hello, Robin. Nice to
Selamat pagi. Good morning. Well, selamat siang. Happy midday.
Midday. Yeah, nice. Today I want to ask about some questions, which these questions asked on the website of Olga's website. So many mothers from Russia, from any part of the planet, and by Russians. These most popular questions I want to ask you.
Okay.
Yeah? Lotus birth. I want to ask about lotus birth and show why it is important.
Okay. Lotus birth and why is it important? You have here, this is not a real baby, but it's a baby doll with a placenta and the umbilical cord. The entire time the baby is growing inside the mother, the umbilical cord and the placenta are attached to baby. They're the part of the baby where the guardian angel lives. The spirit of the guardian angel for this baby lives in her placenta. And so at the time of birth, normally in the hospital, the baby is born, comes out into the world. The doctors or someone clamps and cuts the cord and takes the baby away from the mother. The placenta is still inside the mother. Now, it's so much better if we can just wait and be patient, let the baby be born. We usually, when the baby is born, we just hold the baby here, where the mother can give birth in any position she wants at Bumi Sehad or at home. And then we hold the baby here, and the mother reaches for her own baby and takes her baby to her heart. And then puts the baby close, right? Skin to skin. Now, if we just wait until the placenta is born naturally, it will come, and then we just leave them connected. Because when you start to clamp and cut the cord, the oxytocin of the mother, the hormone of love, is affected. She begins to feel a panic because she knows when she sees the scissors, something bad is going to happen to her baby. So her oxytocin, her hormone of love, goes down. Her risk of bleeding goes up. And so we just think it's better. And it's also culturally appropriate. In the Bali Lantar, the books in Sanskrit, written in ancient times on the palm frond, written with a crysknife, and then just scratched. They don't have pen then, they don't have paper. But many, many, many generations ago, the Hindu people knew that you don't clamp and cut the cord. You just keep baby with mother and placenta and cord also by the side of the mother and baby. And this way the baby doesn't experience a trauma from losing this cord. You know how many people are walking around with a big bag full of their identity and all of their stuff and their hand phone and their credit card and their driver's license and passport, and everything is inside, and then they're so afraid to lose it because this bag is like a representative of the placenta that they lost as a child. So we just give the baby time. And when you have the baby, the cord, and the placenta already born, then you know this is already lotus birth. If you want to wait after the placenta is born and wait for some hours or days, this is your human right. At Bumi Sehad, we always wait a minimum of 3 hours, and then after that, the parents can choose. If they want to leave the baby intact so that there's no violence, then the placenta, the cord, will fall off, will dry and fall off. Usually 3-4 days later, sometimes 5. If you give the placenta a name, it's going to take 8 or 9 days because the placenta becomes more attached to the family. So people think, oh, if this lotus birth is unhealthy, it will get infected. But no, because there's no cut, there's no wound, there's no possibility of infecting the baby. Once you cut the cord, there is the possibility of making an infection in the baby. So with the placenta intact, there will not be an infection. What we do so that the placenta, because it is a piece of meat, doesn't smell bad, is we wash it, we dry it, and then we add salt. We put lots of salt, and then we put it in a basket. Now, with towels like baby blankets, diapers, we can fold them like this, and put the salt, much salt here, and then we can wrap it and then put in a basket, a small basket. Now then you can change this diaper or this every few hours because this will absorb the moisture from the placenta. The first day, we ask the parents to put a plate or something underneath so that when this draws the water out of the placenta and the salt draws the wet out, it does not make the bed wet. But after second day, third day, you can just wrap it and put it in the basket, and it won't have a bad smell. So lotus birth, the main reason to wait before we clamp and cut the cord is there's physiological reason I will talk about in a moment. But the reason to leave the cord so long and let it fall off with no violence is mostly spiritual. Is mostly so that the baby does not feel any trauma of separation. So the baby gets most of the benefit from the lotus birth in the first few minutes. But the spiritual benefit, we don't know. We have to go and check inside our own inner knowing, ourself inside, ask, what does the baby really want? What does the baby's placenta really want? Because this is the spirit, the body of the spirit that lives in here. The spirit is the guardian angel of the baby. So this is a very important spiritual being for your family, genetically identical to baby. So you don't want to just throw the placenta in the rubbish, no. Parents should think about what to do with placenta. Bury it nicely in the place where it will have respect and the child will know my placenta is buried here. You can take to the sea so that the child will circle the world when she grows up. You can put in a pot, and then afterwards, if the family moves the house, they take the pot with them with the placenta essence inside and just put offerings there, flour, incense. When you walk by, just give a little nod because the placenta's angel is nearby. So the physiological reason to delay the clamping and cutting of baby's umbilical cord is very simple. Baby and placenta and umbilical cord, they share about this much blood, 450 milliliters. That's the average blood supply of placenta at the time the baby is born. Now, if the baby is born and immediately someone clamps and cuts the cord, 1/3 or more of the baby's blood will be left inside. So the baby will be shy 150 milliliters to 200, sometimes more, depending on how fast you clamp it. Now, this is 1/3 of baby's blood supply, 1/3. If someone takes 1/3 of your blood and takes it away from you, you will have such severe anemia you must go to hospital. Can you imagine for a newborn baby? How can the baby be bright? How can the baby have enough iron, enough oxygen, enough albumin, and the stem cells if we clamp and cut immediately? It's not possible, and it harms babies. So immediate clamping and cutting of umbilical cord is harmful to your baby. Don't allow anyone to do that to your baby. So this blood, the blood supply of baby, is from the divine creator. It does not belong to the placenta and cord. If you call this blood that stays in the placenta and cord when you immediately clamp and cut, if you call this cord blood, that's not true. The cord has no blood. The baby has this blood. So divine creator wants us to just take time. Let Mother Nature and Father Time do their job so that the blood can move with the action of the placenta pumping and pushing through the umbilical cord so the blood can move into the baby. After the first few minutes, yes, if you want to clamp and cut the cord because you don't want to deal with the placenta, that is a choice you can make for your baby. Ask your baby, ask yourself in your heart, is this right for my baby? If you tune in and it's right, ask the placenta, is it right for me to allow them to clamp and cut now that the blood is mostly moved to the baby? If you feel right about that and you know in your deep inner wisdom that there is time, then it's time. But if your deep inner wisdom says no, the baby needs more time, connection with placenta and cord, then you leave it. Because it's more important than just the blood. There is the spiritual component that we all have to be part of.
Next question. Why we not cut cord? Expulsation of cord stopped after 10-15 minutes. Why not cut it?
Okay. So after the pulsation of the cord in 15 minutes or so. The baby is very busy bonding with mother, bonding with father, skin to skin, learning to breastfeed. If you take the baby at this time, you interrupt the natural progression of Mother Nature and Father Time, letting baby and mother and family bond. So why should you stop them now after 10, 15, 20 minutes just to make a surgical procedure to clamp and cut the cord and throw the placenta to the side? No, better you allow the baby to just be with mother, just gazing at mother. The baby who has delayed cord clamping and cutting is very awake, looking at mother. She or he is really going to the breast. This is a sacred time. Do not interfere by making a clamp and cut of the cord. Just give it time and wait. After a few hours, okay. If you feel that it's the right thing to do, then just keep checking your inner knowing. Ask your baby, ask the placenta, ask your family members what is best. If your inner knowing says it's okay to clamp and cut the cord or burn the cord now, then go ahead. After baby is breastfed for a long time and many times. But don't interrupt the bonding of mother and baby just to cut the cord. Do not interrupt the bonding of mother, baby, and family just to measure the head, measure the length, weigh the baby. The baby doesn't care what she weighs. The baby only cares about this, being close to mother and being close to family and being close to placenta and cord. Remember, in the womb, baby has been bonded with this cord. Baby's been playing with this cord. Baby already knows that this is a real being with a soul. This is his guardian angel or her guardian angel. And so the baby has a relationship with this angel, plays with the angel, loves the angel, and feels the love of the angel, keeping mother and baby alive through the entire pregnancy. This little angel is the advocate that makes sure that the baby gets all the nutrients and then takes away the waste. The baby gets the oxygen, takes away the carbon dioxide. Without the placenta, the baby would die. The mother would not survive pregnancy. So this is truly an angel. There's no reason to separate them so fast. So even after the cord has stopped pulsing, give it more time, please.
The next question is, blood can go from baby back to mother if we not cut the cord.
No.
Blood can go from baby back to mother.
No. The question was, can blood go from the baby back into the placenta? Because placenta is separate from mother. Placenta and baby have one blood type. Mother can have same blood type or different. Because even though the nutrients pass through the placenta and the waste goes away and the oxygen passes through and the carbon dioxide goes away, even though this special exchange happens, the blood does not mix. So if the placenta is still inside mother, the placenta more belongs to the baby, not the mother, even when it's still inside. But the blood will not go back into the placenta from the baby, because when the cord is exposed to the air or in a water birth to the water, to the outside world, then it changes. Only the blood going into the baby will keep going into the baby. The blood going out will stay in. This is just a very simple scientific fact, so you don't have to be afraid.
And if placenta is dying, why we leave it with babies?
When you have a loved one and they die, sometimes you go and you visit them, their body, before they bury the body. Even after they bury the body, sometimes you go to the grave and you just sit there for a meditation or a prayer. And after the placenta is died, the baby maybe needs to say goodbye. Let's give them time. I'm not saying to give them a year, but a few hours, a few days, okay. Because also the placenta dies a slow natural death. The placenta does not die immediately when baby's born. The placenta is dying after the birth of the placenta, after she comes out of the mother, and she is still pulsing, still alive, still. Even after being born, the placenta is still pushing blood. And after all the pulsing is stopped, okay, the dying is beginning. But the dying can take hours, even days. Just give it time, because we don't know exactly when placenta has died. So the question was, will we have more problems with jaundice or yellow babies after a lotus birth or delayed cord clamping and cutting? The research shows that it is not a significant problem. At Bumi Sehad, we do not have more jaundiced babies than at other places where they do immediate cord clamping and cutting. In Bumi Sehad, we do delay, and we don't have more jaundice. So go to any hospital where they do immediate, you will see a certain percentage of babies actually getting the blue light therapy because they have jaundice. We have very few babies that need blue light therapy because not only is the extra blood going in the baby, that's not extra blood, this is the blood the baby needs. Because all of the blood has gone into the baby, that does not mean the baby has a higher risk of jaundice, because also along with blood is albumin, and albumin prevents jaundice. So this amount of blood, this full blood supply for baby, will not cause the baby to be jaundiced, because imagine, Divine Creator is not foolish. Divine Creator would not give too much blood to one baby. Divine Creator has a plan for each baby to have everything she or he needs. So let the baby have all of her blood. If the baby becomes jaundiced, that is an easy solution. It's the sun, breastfeeding, giving the mother to drink fresh orange goes in her milk and she breastfeeds, the jaundice will be resolved faster. If the jaundice is truly pathologic, not physiologic. Physiologic jaundice is fine. It's just a normal part of baby transitioning gently into our world. But if the jaundice becomes pathologic, meaning that there's some illness associated with it and the baby could be depressed or unwell, then you can do blue light therapy, no problem. But to prevent this, delay the cord clamping and cutting so the baby gets all of his or her albumin, because that prevents jaundice, so the delay actually prevents. Also drink plenty of orange juice while you're breastfeeding. Don't give the baby orange juice, just give the baby exclusive breast milk, but the vitamin C will go in your milk and will help the baby to prevent jaundice. The question is it possible to have lotus birth with cesarean? So in Bali, we before had many doctors, Dr. Haryasa Sanjaya, Dr. Wedagama, Dr. Devakutut Ardika. These doctors would really understand the spiritual nature of birth, and they themselves are very spiritual. And so even in a cesarean birth, if the parents requested it, they would keep the baby and placenta and cord as one intact. Just wrap it in a towel and give the baby directly to mother for breastfeeding. There is such a thing as cesarean lotus birth, so don't let anyone lie to you and say it's not done. I have seen many, and with total success, no problem, no worries. Okay? Cesarean lotus birth. Imagine Dr. Haryasa's own child was born by cesarean and a full lotus birth. They never clamped and cut the cord. Everyone said he was crazy like me, but it's okay because he's crazy for love. He's crazy for spirit. And I think it's good to be crazy for spirit and crazy for love. The question is it possible with an Rh negative mother or a different, intolerance of blood between mother and baby, if there's, or usually that's not an intolerance. Usually when the mother is Rh negative and the baby's Rh positive, it's usually fine. But even if there is an anomaly of the blood, something different, don't worry, you can still have lotus birth, no worries. We have done it at Bumi Sehat many times. Also remember, if the mother's blood type is different, if there's no trauma, if there's no pulling the placenta out violently, then the mother's blood and baby's blood will not mix. So there will be less issue with Rh negative or positive mother and baby. The question was about the breech baby. Can we have natural birth? I have received babies into the world breech safely. There is some research that says that the baby who is breech delivered through the vagina has a more possibility of injury or problems statistically, because many people don't know how to deliver the breech gently and properly. If everyone is willing and you can find a gentle, nice place, it's also very difficult because now in Indonesia there are regulations saying the midwives are no longer permitted to deliver the breech baby, whereas we always did it before. So now it's a bit confusing because we have the skill and the parents come and ask us to help them, but we're forbidden to do it. So sometimes you have to find someone who's willing to go a little outside the box to help you with the delivery of your breech healthy. A healthy mother with a breech healthy baby can deliver safely, no worries. Okay? The question is if you have minus eyesight and you're wearing glasses or you're wearing contact lenses, that if you have your baby, you are not permitted to push and you must have cesarean. This is a complete lie. You do not need a cesarean. I recently talked to a doctor who's a specialist surgeon for eyes. He told me that any doctor who tells you that because of your eyesight you must have a cesarean is lying. Do not believe them. You can Google it yourself. There is no risk for the mother's eyesight if she has a normal birth. So do not believe. When someone says that, you run from them because they're a liar. I don't like to call people names, but never should a doctor or midwife or anyone lie to the mother and baby and lie to the placenta angel. This is a sacred time, pregnancy, and when people make a mother afraid, this is called prenatal scare. This is not prenatal care. We cannot scare mother, we have to care for mother. So if someone tells you that because of your eyesight you must have cesarean, run away from them.
Ultrasound diagnostic, is it healthy or good to have it or better not to do?
Ultrasound is a very special tool. We know that we can now see so much about the baby. How is the baby doing with the ultrasound? We have ultrasound given to us by a Russian mother here in Bumi Sehat, and we use it only when necessary because sound is like mantra. If you make a sound that disturbs the baby, then you're hurting the baby. And we don't know really the side effect because we don't have many generations yet of ultrasound. My own children and grandchildren, we did not ultrasound. Okay? If there is something really unusual, then ultrasound can be a life-saving diagnostic tool. So I believe in ultrasound for diagnosis when needed. But I also think that, you know, the divine creator did not make a window on our belly. Our womb has no window. So why should we look inside? It's supposed to be a secret. Do not do ultrasound to find out if your baby is girl or boy. That's silly. It's a divine secret. Let the secret be. Be curious, be happy, be expecting and wondering, what is my baby? And anyway, even the doctor says, oh, for sure you have a boy. Oh, for sure you have a girl. How many times has a baby not the same sex that the doctor said? Even one time we had a mother who went for 4 ultrasound, 4 different doctors, all said boy. Girl came out. You know, when she saw her baby, she was loving her baby, but when she saw the sex of the baby was girl, she already thought for months her baby is boy. She said, this is not my baby. When she was pregnant the next time, she refused ultrasound. She said, I pushed my baby away because ultrasound. The doctor didn't know. The doctor told me something that's not true. The doctor doesn't want to lie, but he didn't see correctly. So ultrasound can be an incredible diagnostic tool, life-saving, really. But remember, if you do an ultrasound and the doctor says, oh, you must have a cesarean, there's not enough water, their amniotic fluid is too little, the baby is dry, when you have the birth it's dangerous. Ask yourself, how does the water get inside my womb to be there with the baby? The only way water gets inside is you have to drink water. So the honest doctor doing ultrasound, if she or he sees that there's not enough amniotic fluid for the baby to safely be born, the honest doctor, the intelligent doctor says, please mother, you need to drink a lot more water. And if the water she drinks is really very, very much, then she can have acupuncture, because if the water doesn't go in the womb, then the acupuncture can adjust so that the body, so that the water will go in the womb. So do not give up. Just because you have very little amniotic fluid, do not go home and plan a cesarean. Go right away to get water and drink it. Okay? Because water is life. And water is life for your baby. So your body does bring the water to your baby. But you have to drink it.